You're listening to Shmu In Focus, a podcast that takes a serious look at the issues important to you. Join us as we explore poverty in Aberdeen, sharing personal stories, insights from experts and perspectives from the ground. Don't miss Shmu In Focus. Real talk, real issues, real solutions.
Hello. If you live in one of the areas in Aberdeen here in Scotland, you are likely to die 13 years earlier than if you lived about a mile away in a more affluent, richer area in the same city. And if that isn't shocking enough, in the same said poorer area, you're on average like to have 25 years poorer health quality of health too. This was information that a local GP advised politicians in August 2024, warning of the health implications of removing a green space in a deprived area in the city of Aberdeen. Today on Shmu In Focus, we are going to be exploring the health inequalities as part of Poverty Alliance's Challenge Poverty Week. Wherever you are living, we are directly or indirectly at risk of health poverty. With me today, we've got Professor John Bone. He's a coordinator of Aberdeen Just Transition Lab from Aberdeen University, and also B. Dawkins from Aberdeen City Council for the Health Determinants Health Determinants Research Collaboration. Welcome to you both.
Thank you. Thank you for having us.
You're very welcome. Okay, so B is currently involved in in fact, I'm not going to read that bit out. You can tell me all about it. Tell me about what you're doing.
So I work as the Promotion, Involvement and Engagement Coordinator for the Health Determinants Research Collaboration in Aberdeen, which, as well as being quite a mouthful, is a really important initiative aimed at addressing some of the health inequalities that exist across our city. So it's really looking at the kind of all the day-to-day factors that add up over the course of a person's life to have quite a severe impact on their health and well-being and their health outcomes and life expectancy. And so we're kind of looking at what levers the local authority has to affect some of those things, so such as transport, housing, employment, safety, neighbourhood safety, community, all these day-to-day factors that on a day-to-day basis don't have too much of an impact but add up over the course of your life to really shorten your life expectancy.
Okay, and we'll get more into that in a moment. So Professor Bone, tell us about yourself and what do you do?
I'm a sociologist. My specialism is biosocial theory and political economy, and I have a particular interest on the impact of insecurity and inequality on individuals, communities, and its wider ramifications in terms of politics. You can look at what happened a few weeks ago in terms of the riots in the UK, the rise of populism. The roots of this are in poverty and inequality and insecurity. That's where it starts. It happened in the 1930s. It's happening again now.
And the populism being possibly akin to that of fascism in Europe.
Yeah. I mean, what we're looking at is the rise of the far right across Europe, the United States, a very polarised politics and increasingly angry and conflictual politics, and it has the same roots as the poverty and inequality that we're talking about.
So health poverty, just to give you a couple of pointers, then please direct me because you're the experts, I'm not. If memory serves me correctly, if we look at the World Health Organization, health is the physical, social, mental well-being, not merely the absence of disease. And then there's well-being, which again, these terms here, which we hear banded around, the Office of National Statistics have got like 10 categories. So it could be your environment, it might be health, it could be economy, and one that probably doesn't get a lot of talk about is also governance. So we maybe touch on more about that, how things are governed or not, and as a result, the impacts that have on there. Definitions okay? Sort of brief summary?
Yeah, that's fine.
Fantastic. So tell us about the work that you're currently doing. Who wants to go first? Go on.
So yeah, the work of the Health Determinants Research Collaboration, I'm just going to say HDRC for short.
Probably easier.
Yeah.
You should change it to SID or something so it's easier. I'm working with SID today. Yeah.
Working with Sid.
Yeah.
Yeah, so our initiative is really quite it's like culture change initiative at heart, to try and make the city more research active and evidence led at all levels in how it makes decisions, so that these services that support members of the public are designed in such a way to promote better health equity rather than to perpetuate this health inequalities. So really looking at through all of our public services through that kind of health lens, and making sure we're really robust in how we're using the available evidence, linking in with local universities, local expertise, such as John, who has some really interesting research to talk about, and just making sure that's used in the most effective way to make good decisions.
It's evidence-based, objectively looking at need and risk?
Sorry, repeat that.
Objectively looking at need and risk. Would you say that? You're seeing where the needs are and where's the risks and balancing it out.
Sorry, yes, I see what you're asking. Yeah, so we're aligned with Community Planning Partnership and their Local Outcome Improvement Plan.
Oh, the so-called LOIP, yes.
Yeah, the LOIP, our favourite LOIP. And so that gets refreshed every couple of years, and there's a citywide consultation exercise with communities all across the city, asking people, what do you think are the biggest areas for improvement in your lives, in your communities, and then combining that with a population needs assessment, which is more like hard data that we have on people's health and well-being, combining them, and that kind of creates our local outcome improvement plan. So we take our research priorities from the priorities that come through the local outcome improvement plan.
Okay. I'm going to come more to that in a minute. But can I call you John rather than Professor? Is that all right? Yeah, fantastic.
Yeah,
excellent. So John, if you're doing your work and your research, is that similar to what's going on here, or is that very different to what's
well, it's actually involved with I'm part of the HDRC as well.
Okay.
I've got a number of hats. I also advise Aberdeen City Council on anti-poverty and inequality issues. As far as the JTL work's concerned, my colleagues and I have been looking at how the energy transition's affecting people in the city.
And just for those who don't know what that is, what is energy transition?
We're moving towards a net zero economy. We are moving
so
out
not burning fossil fuels. Yeah,
not burning fossil fuels. And so that transition's going to happen. We're into that transition now. So what we're interested in is what's actually happening to. We take a holistic approach, a systems approach to this. So what we want to understand is what's actually happening to the city across a range of areas, and with a particular interest in inequality and well-being and health. That's the aspect that I'm particularly looking at. My colleagues are looking at things like jobs and skills and governance and political participation. So at the beginning of the year, we released a report on measuring indicators of just transition, but it relates quite closely to what we're doing in the HDRC, because it's about how people are managing this transition and how it's going to affect different communities. And inequality is at the heart of that. How can we create a city that's more sustainable, fairer, where that improves people's health and well-being?
Okay. And are you finding, because this is a huge subject in itself, and your different bodies trying to communicate with each other, is that, you can be honest, is it working? Is it working so far? And is it actually benefiting the people, or do you think it will benefit the people of this project? I would say that
it is, because previously you had lots of people operating in very different silos. Now we have got a situation where you're bringing together people from the council, people from the universities, Aberdeen and RGU, and various other agencies in the third sector. I mean, I've got to know a lot of people in the third sector across the city. And there's a sense in which after you work with people for a while, you begin to understand what they're doing in their particular areas and what knowledge bases they have and what's going on that you don't know about, their understanding of lived experience and so on. And so it's a way of building a picture, and having built that picture, it gives us a better idea of where intervention needs to happen to improve things.
Is there a risk, do you think, of a giant silo, or you're not seeing that at all?
I wouldn't say.
I didn't want to go down the rotten apple
Right,
and ruin the whole
yeah.
barrel, but the giant silo.
I'm not. I wouldn't say giant silo. I think what happens is you get a what you might call a fusing of horizons, where people begin to have a more holistic understanding of what the problems are, and therefore better understanding of maybe how to address them.
Okay. And I'm going to come back to you in a second, B, but just do you follow a particular methodology, a way of thinking about this, or is it just still learning the process at the minute?
The methodology that I follow is basically a biosocial model that I've developed myself over the last 20 odd years.
Okay.
Where I've been interested in the way the individual engages with society from the individual up. Start with the individual's engagement with society, and then look at how that affects communities, and then larger collectives.
And then bigger structures again.
I'm interested in too many things, really.
But surely on this subject, that's absolutely necessary, because
absolutely.
if you are only looking at little bits, you're not going to see the implication. I mean, you're saying about how different bodies work. I'm thinking when the strikes happened with the fuel in 2000, there was a decrease in number of operations happening because people who were NHS could go out and get fuel, and it was probably more gender dominant at the time. Most, still is in many ways, but most the nurses were female, and they couldn't leave their kids because the teachers were off. So as a result, the operation couldn't occur. So is it like trying to identify what might go wrong in some respects, and then how can things be not going wrong? And secondly, how do we make them more efficient? Is that kind of how I'm picking that up?
Yeah, well, that's how systems operate.
Yeah.
If you take one part of the system out, then the system starts to fall apart.
So with the strikes, they were giving help with one, but they didn't with the other, and as a result, and I was looking at your research, and it's to do with epigenetics. Is it
I've become again. I'm too interested in too many things. I'm a sociologist, but I draw on history, politics, economics. For the last 20 odd years, neuroscience, because I did psychology as an undergraduate, and the last few years I've become more interested in epigenetics.
And tell us what that is briefly.
Well, epigenetics, to define it, is effectively how our genes are expressed. So it's changes to the way genes are expressed without changing the genome itself, without changing our DNA.
Yeah, so your DNA stays the same, but something else is changing within you.
The same.
Yep.
And this is happening all the time. Yeah, as we engage with the world, the way our genes are expressed are changing all the time.
So whether that's pollution or diet, the whole range of things.
Pollution, diet, and inequality of itself affects gene expression.
And you mentioned that in your report to the council last year. You talked about that in the council, And what was the feedback on that, and what's going to be done about it? I don't know if B wants to come in at all on that as well.
No, I'd like.
Well, I think that this is fairly new. I don't think they've really picked up on this yet. I've written a lot about this lately, and it's a kind of new area. When you talk to people about this, they kind of sit back and say, what?
Yeah.
We used to think that, disparities in health, a lot of people, and there's a lot of policymakers still thinking this way, that disparities in health are due to poor lifestyle practices and so on.
So blaming the individual rather than why the individual got where they are.
Individualising a societal problem.
It's a bit like recycling when they say, well, it's your own fault, you're not recycling enough. Like, well, hang on a minute, are you engineering out the needs to recycle to start with? And that's not happening, and as a result, you need to, like you say, the systems, you've got to step back.
And carbon footprint.
Yeah.
Yeah, precisely. So, but in actual fact, just to pause there from what you're saying is, the individualisation is a problem of itself, because there's a writer, Jo Littler, and I've drawn on her work. Jo Littler has talked about the way in which people have this deep sense of shame if they're in poverty, which is a structural issue. They've often got very few opportunities open to them. It's happenstance that they've ended up in that situation, but because of the dominant rhetoric in our society that everyone could pull themselves up by the bootstraps and so on, there's a lot of self-blaming goes on, and that self-blaming in turn also affects their health
Yes, stress.
And well-being.
Yeah,
It
absolutely.
adds to stress. Stress has epigenetic effects that affect our health. So it's a vicious circle.
Vicious circle. And I think I saw a diagram actually with all the different sort of arrows sort of pointing where this comes from. For example, poor diet equates obesity, for example, and so on. Now, B, we haven't talked too much about to yourself. What you're finding so far with the research? I know you were giving an interview with Shmu actually a few months ago, talking about the idea of grit bins and trying to do that and reducing the slippages and falling over. But what beyond that? What have you finding so far in your research?
So I'll just clarify to start with, I'm not a researcher.
Okay.
But we do have very capable research staff in the HDRC, and I should probably also clarify that one of the main points about our HDRC is that we work collaboratively. So rather than us doing the research ourselves, we're working with collaborative arrangements, let's say, of say council staff and university academics and people in the NHS to support them to do good quality research. So it's not about adding anything new to people's plates. It's kind of about supporting the things that are already happening, naturally occurring. So we're supporting some work looking at preventing drug-related death. We're doing some work evaluating the effectiveness of various interventions around supporting people out of fuel poverty. We're looking a little bit at infant food insecurity in developed nations, such as Scotland and Aberdeen. And there's heaps more that have just completely gone out of my head.
That's okay. That happens.
Yeah, there's loads.
So you've got that, and as you already alluded to, John, there are structures there. So you're operating within those existing structures and trying to make them more efficient.
Absolutely.
But do you look at and say, hang on, actually, we have a structural reason why things aren't working as well? And are you in a position to turn around to body X, Y, or Z and say, look, for example, let's look at the transport. People could probably argue about issues regarding the transport, but if the information goes down from the Scottish Parliament to local government and say we want you to do X, Y, and Z, now whether they've got the resource to do that, that's one thing, but there's also a presumption of competency. Are they making the best choices? And they might not be in a position to turn around and say, actually, the system set up, we can't do this because it's not politically, whether that's from the politicians or the officers, they can't turn around that, and that has a knock-on effect on health, for example, with that. And similarly with health, more specifically, it was great that you in your previous interview you talked about people realising about the grit bins and that's reducing falls and so on. But the issue with health could be that the organisations themselves may inadvertently or would fail to acknowledge that they are actually a creator of poverty or a creator of health issues as well. For example, there's lots of efficient ways you can insulate homes, but the new builds aren't being made to go to that standard. They might be to a higher standard than they were before, but they're nowhere near as high as they should be. So is that a conversation that you can actually have and say, actually, hang on, you're saying you want to make things net zero for energy efficiency, for example, or helping the environment, but you're not actually doing that on the ground when it comes to passing housing planning bills and so on.
Yeah, so if I'm picking you up correctly, it's about that kind of the translation of evidence into policy and practice.
Yeah, absolutely.
That aspect of it. So I think there needs to be a recognition that in terms of influencing policy and practice, evidence isn't everything. It's, of course, a phenomenally important part of it. It's absolutely integral, but there's more aspects than just evidence that influence policy and practice, such as a political appetite for certain changes, staff capacity, financial resourcing, etc. And that is really probably one of the biggest challenges we have, is making sure that any research that we do ends up with policy recommendations that are actually realistic for the current climate. And I think that will continue to be a massive challenge going forward.
It's a fair comment. But if you are going to get to net zero, for example, and that's going to have an effect on health, because with insulation, for example, with health, you can improve, lower your fuel bills and improve your air quality and so on. Mm-hmm. And if you can't get to that point, it's still, I don't mean it's disrupt to yourselves, but it's still just talk. It's not getting beyond the next point we need to get to. So how is the research you're doing obviously influencing the other players in place, but ensuring or helping to get those benefits? Both of you to that question.
Any kind of policy intervention is going to be entering a contested terrain. We know that, anything that's advocated, whether it's changes to building practices, as you've just mentioned, whether it's the move to net zero and so on, it's because you've got vested interests, you've got lobbyists who've got the ear of politicians and so on and so forth, and who are trying to convince politicians that their way is the way to go. Of course that's going to be the case. I think what it comes down to is to do the research and make the evidence so compelling that eventually the defence against using that evidence becomes indefensible. And that's how change happens. When you see a problem, when you present, and I mean that's basically what my work is aiming at, is to say, okay, these are the things that are causing societal problems: health, well-being, lack of social cohesion, political instability, economic instability. This is what I think. Now, I'm by no means the final word on this, although my students would never know that.
They do now.
They do now. But the point is to try and make that, to uncover the evidence and present that evidence in a way that convinces people that that's the way to go.
Okay, so it's I don't want to use the word compromise, there's probably an element of that, but it's also just trying to negotiate through the existing structures and trying to nudge that along whilst you're up against very, very powerful interests.
You have ideological positions as well. You've got people who've... we are cognitive misers. Human beings don't, once they have acquired a knowledge base, and that's related to the kind of work that I do, it's very difficult to change minds, especially if people have held positions for a long time. And
they've got a certain interest, and if that interest changes, they're going to benefit from what they had before.
And quite often their identities are associated with a certain set of beliefs.
Which I suppose possibly that fits in with the energy transition. I mean, Aberdeen
Absolutely.
is very much oil and gas. There's still going to be an element of that regardless, because there's still going to be a need to transfer for a long period of time and ensure possibly from a point of energy security even a small percentage of what we're doing right now. So there's still going to be an element of that, but it's what do you then do and how clear is that? Is there still jobs and
You're asking people to change a way of life, and a way of thinking about themselves, how they relate to society, how they relate to their occupations and occupational identities.
I'm thinking of the closure of the coal mines, and the impact that had on those towns.
Yeah. Well, that's the one thing that we want to avoid in the city, is having an ex-coal mining town scenario, or Rust Belt in America scenario. The cities where they had large car plants which folded and left these cities in a quite terrible state. Now, I don't think that's going to be the future for Aberdeen. I think there are already moves afoot to restructure the economy and so on, and there's a lot of people working on ideas to try and support that. And we've got a lot of resources here. We've got 2 universities that have a good reputation. We've got a good knowledge and skills base and so on. But it's just making that transition. I think one of the things that would concern me is we try to hold on too tightly to what's gone on in the past, and don't make the shift quickly enough.
And that becomes a cost in itself.
Absolutely, because the city's got to redirect itself. I think there's lots of people that are aware of that in the council and elsewhere, that there needs to be a refocus and a sort of reinvention of the city for the future.
So with that in mind then, if people are watching or listening to this right now, what can they do? For example, interacting with yourself. I think you've got an event maybe coming up in a bit. You might got in contact about that. Tell us about that.
Okay, so very exciting. We have our first HDRC conference happening on Monday, the 4th of November at Aberdeen Beach Ballroom. It's open to absolutely anyone, academics, professionals, practitioners, communities, private sector, third sector, public sector, anyone. Absolutely anyone's welcome to come along. We'll be focusing on our various priority areas for research. We'll really be taking a focus on making connections to support the work that's already happening in our city, to support collaborations to happen in the future. In fact, sorry, can I say that again?
Yeah, please.
Sorry.
do the whole thing. Do the whole thing again.
Oh my word!
So
I'm not cut out for this.
So I understand there is an event coming up later on in the year. Tell us about that.
Yes, so very exciting. We have our first ever HDRC conference coming up on Monday, the 4th of November at Aberdeen Beach Ballroom. It's a whole day event that brings together members of the public, academics, public sector, third sector, professionals, practitioners, absolutely everyone. Did I say communities? If I didn't say communities, I meant to say communities. Absolutely everyone together to talk around these kind of wider determinants of health in the context of inequalities. And really a focus of the day is about making new connections to support the work that's already happening in these kind of priority areas. And yeah, we're hoping it'll be a really good productive day. So sign-ups are open. You can visit the HDRC website if you would like to sign up for that. So just Google Health Determinants Research Collaboration Aberdeen if your fingers have enough energy to type all that out, and it should be the #1 hit on Google for you to find us there.
Okay, and if that is there stalls for that there, or they already been taken up, or is it just giving presentations, or how does that work?
We're not doing stalls, but we've got some really good workshops that should be quite interactive on our various research priority areas, and we're also inviting members of the council. Sorry, I mean
public.
Council staff from various teams that are related to these wider determinants of health.
It's trying to link it all up together.
Yeah. To develop posters for people to learn a bit more about their areas and where they're trying to develop any questions they have about their service that they're trying to answer, and get people working collaboratively to try and answer some of these research related questions.
And will you be along on yourself?
Yes, I will.
You're fantastic.
For your
Are you giving a presentation, or are you just going to have a workshop?
I'm running a workshop on
Yes, you are.
insecurity and inequality.
Okay.
Because I was press ganged into it by me last week.
Well, perhaps whether it's, I don't know, film on my mobile phone or something, we could maybe get an update on the day with that as well. At some point, that would be really
cool.
useful.
Yeah, absolutely.
Yeah, absolutely.
Yeah.
Yeah, that's fine. Yeah, I mean, with what you were talking about, I think one of the issues when you're dealing with this kind of change that we're going through, change of itself is problematic. So, and it has health effects. So when people go through large-scale social change, so for example, when the oil downturn, one of the things that we noticed in the JTL's work, through the JTL's work, was that healthy life expectancy dropped in Aberdeen, more so than anywhere else in Scotland, and it was quite evident. And my take on that would be due to the stress of what was happening in the city. So going through these things, socially, in terms of health and so on, is never easy. And you've also got the issue that people tend to think that what's happened before is going to continue into the future. Now, this is a big issue, not just for Aberdeen.
Is that part of a learning process, though? Because you always go back to what you know,
Absolutely.
even whether that's right or not.
Absolutely. People rest on what they know.
It's nice to start with a blank sheet of paper, but your instinct is to go, oh, hang on, that happened in the past, and then that steers your judgment. I think the HMRC call it an optimism bias for certain projects, and there's like funding bias. There's all sorts of biases that you can be
Motivated reasoning.
Yes, yep.
Yeah. I mean, of course, and people always make decisions based on what they know previously. That's the way we think. I mean, it's as fundamental as that. I think one of the problems is that we've got at the moment is not just in Aberdeen, but everywhere, is that we're on the verge of one of the biggest transitions societally.
If we don't, we're in trouble.
Yeah. Yep. Well, we've got climate change.
Yes.
But we've also got AI and automation, which is, in my view, and a lot of people are quite sanguine about this and think it's going to create lots more jobs and so on. I don't think so. I think we're going to have to go through a fairly fundamental societal shift to deal with that. I think it potentially means that the relationship between work and how people sustain themselves is going to have to change, and I don't think it can be accomplished within the confines of the kind of thinking that's going on at present.
So hopefully what we're discussing today is going to nudge in that direction to be more efficient. I know there's going to be controversy. I won't go into my personal situation, but because that would take forever. But I know from my community where I live in Torrey, there's definitely issues regarding so-called energy transition and massive health issues there. And I know when the documentation and even the past, they've talked about asking you what you score between 1 and 7 on influence and and sense of control. Scored very, very low. The only more recent reports I've seen is it's looking for the whole south of the city as opposed to Torrey, which gives a higher score. And I know we did a poll last year for the community council on what they wanted for the local park. I know I personally wrote it, the question, I based it on the Electoral Commission's rules on referenda, so I try to be as impartial as possible. And all those who correctly put the vote in, because some people say, what's the point? People will do what they want to anyway, they're not going to listen to us because that's how people feel. 100% said yes, and yet the direction of travel is completely contrary to what the local doctors have said and the local people want. So it's hopefully what you're discussing is going to be better coordinated, and maybe in the future communities and indeed all other parties will be more objectively looking at what's going on. But I want to say thank you very much. Before while saying, if anyone wants to get in contact with you, is it the same website you mentioned previously?
Yeah, and then we also have an email which is hdrc@aberdeenscity.gov.uk.
Superb. Thank you very much for your time.
Thank you very
Thank
much.
you.
Thank you for listening to Shmu In Focus. If any of the topics we've discussed resonate with you, remember that you're not alone. Support is available. Take care and be sure to join us for our next episode as we continue to explore the issues important to you and your community.